Hi, welcome back to IU Radiology Case of the Day. My name is Nick Kuntz, and I'm a neuroradiologist and head and neck imager at Indiana University School of Medicine, and I'm back with another interesting head and neck imaging case of the day. So I'd like to start out by stating, as I always do up front, that all the educational content found as part of this lecture has been completely de-identified in order to protect patient privacy. So this is a patient that presented with asymmetric hearing loss, and I'll have a couple of images for you to look at. So we have two coronal bone protocol CT images to look at. These are images through the temporal bone. So take a look at the images. One is the image on the left is on the patient's right side. The image on the right is the patient's left side. And again, these are in the coronal plane. So keep in mind that history, asymmetric hearing loss. Take a look at these images. Try to piece it all together. Okay, so a few questions for you this week. First of all, what's the most likely diagnosis? Second question, do you think they have a conductive hearing loss or a sensorineural hearing loss? And then the third question is, what hobby or what hobbies might this patient have? Okay, so let's take a look at the imaging. Again, we have a non-contrast CT in the coronal plane. I'm just showing you one of the sides. The findings were bilateral, so you can apply whatever you saw in this image to the other image. But what we have is circumferential bony overgrowth of the osseous segment of the external auditory canal, denoted here by these yellow arrows. And if you look where this yellow arrow is pointing, you can see that there's really severe narrowing of the external auditory canal aperture. It's been encroached upon by that productive bone change. But importantly, we don't see any soft tissue mass component, and the bones look clean. There's nothing that looks destructive or chewed up or ratty or aggressive about these bones to make us think we're dealing with an aggressive process. So, what does this patient have? They have EAC, or external auditory canal exostoses, and these are benign bone lesions that we see pretty uncommonly in the external auditory canal. And this is simply a bony or osseous overgrowth. They're oftentimes broad-based or circumferential, and they're thought to be a response, or at least in a lot of cases, a response to chronic cold water exposure. So this oftentimes goes by the name of surfer's ear, but it's also been reported in kayakers, divers, open water swimmers, people who have chronic cold water exposure into their external ears. Typically, these imaging findings will be bilateral, but oftentimes the symptoms are either unilateral or asymmetrically worse on one side. These patients will present with a conductive hearing loss because we're impairing that chain, that pathway by which sound waves get propagated and collected by the external ear and then eventually get transduced by the ossicular chain at the oval window. These patients can also have symptoms like recurrent otitis externa because that aperture is narrowed, so they may get water and bacteria and stuff just smoldering in that narrowed external ear. Sometimes they'll have ear pain, and tinnitus has been reported as well. Kind of an interesting article to take a look at if you want to look at sort of the some of the science that goes behind this, and looking at these external ear exostoses and some of the glimpses that they can provide into the history of the human species as it's developed over time. So just an interesting paper. It's a kind of a quick read that you can find the reference to down at the bottom, but talking a little bit about just sort of how this may have played a role in the natural history of mankind and some evidence of an aquatic phase of early man's evolution. Okay, so to wrap this case up, this was a case of surfer ear or EAC exostoses, and really the key imaging features here are that would be that bony proliferation and overgrowth involving the osseous segment of the external auditory canal. This is going to be either broad-based or circumferential, and as this case showed, it will eventually, if severe enough, narrow the external auditory canal aperture. These will typically be bilateral, but usually it's going to be asymmetric. One side will be worse than the other. A couple of pitfalls. Don't confuse this for an EAC osteoma. Those are different. Those are typically going to be unilateral, and it's more of a focal protuberance rather than a broad-based or eccentric a circumferential or concentric lesion like this is. And while these are classically described in surfers, keep in mind you can see them in other patients with chronic cold water exposure, like kayakers, divers, open water swimmers, etc. Well, as always, thanks for tuning in to IU Radiology Case of the Day. You can follow along on Twitter at NAKuntz, and I would invite you to check out our complete collection of Case of the Day materials that can be found at radtf.iuhealth.org/COTD. Thanks so much.